Hi, here we are at the next episode of the Ben and Gary Show. We know dentistry. And I really appreciate you sending in your questions. It's been really a lot of fun answering them. We have, I believe it's Sheila from Oregon, and she says that, she has this smile that she doesn't like. And the reason being is that she sees too much gum tissue when she smiles, and her teeth are kind of small. So let's just talk about that for a second. That's honestly referred to as the gummy smile, and perhaps maybe we can talk about that there might be a solution or two. And, but honestly, that starts with what honestly causes the gummy smile. But let's back up for a second. Honestly, there are some patients that will tell us that, I hate my smile and I just don't like the way it looks. I feel self-conscious about it. When we talk about it here, we refer to that as the excessive gingival display.
Right.
And it has, that's the technical term when we want to talk dentistry.
But we like the gummy smile.
Yeah, the gummy smile. In some cultures, it's a very attractive look, and others, it's not so much so here. So, I guess there are solutions for that, and know that there are. But the solutions that I expect that when we'll be able to talk about are all contingent upon what's the cause of the gummy smile. So, Gary, what do you think? How would you say the gummy smile is sort of defined, and what causes that?
Well, you got to look at everything that's involved. You have your lips, you have the jaw, the teeth, and of course the gums. And oftentimes there are various things that can cause that gummy look. And so one of the things is that the teeth don't erupt properly, and they're still covered by the gum tissue. Other times it's because the tooth is a little bit too short relative to the amount of gum tissue that you see. And that can be caused by either the wear of the teeth or just by genetically you have short teeth. So those are a couple things. Other things are, especially when we talk about the lip could be just a little bit too short, and so it doesn't come down far enough to cover the gum tissue. Or you have a hyperactive lip, which is when you're at rest or you're smiling, when you're at rest, everything looks normal, but when you smile, the lip it comes up too high and exposes too much gum tissue. Other times it can be because of too much gum tissue or an overgrowth of gum tissue, and then we have to correct that by removing the tissue level. And then there's a thing called the vertical
maxillary excess.
Right. There you go. Yeah.
Right.
So those can all contribute to the gummy smile.
Right.
We all.
And I think it's probably a good idea for us to kind of run through, because honestly, all these problems with a gummy smile can have different solutions based upon what the cause of it actually might be.
Right.
So in that respect, there maybe we talk about some of the treatments that are available, and based upon what they might be addressing.
Okay. That sounds like a good plan.
Right. Some of the options, especially if you see it's like a mild excessive gingival display, the lip is normal, then perhaps just some orthodontics. Some mild orthodontics can be able to be used to straighten the teeth and just give them a much better appearance.
Right. Yeah.
That's kind of simple these days. If orthodontics for adults, particularly, Invisalign is a fun treatment. I actually think it's fun. It's cool. And it's actually something that if you're the control individual here, this allows you to be able to control your own destiny on Invisalign, because guess what? Those aligners that you're using are all contingent upon you actually doing it. And if you don't do it, then guess what? It doesn't work. It sounds so simple here, but there are others who are just very, very meticulous about what they do, and it works beautifully well. And just by realigning teeth into a better position, you just generally have a much better appearance. And many times that space, when you see that much gum tissue between the top of your teeth and your lip, can be improved just by moving the teeth and just giving you a much better, more uniform appearance. Now that's fine if it's mild, but
what if it's excessive?
Kind of moderate to severe.
Yeah.
Well, maybe that might be that where you see not just teeth, but you see a lot of gum, and then finally the lip is up higher than that, and you might actually see that from not just in the front teeth, but also to the back teeth. So it looks like your whole jaw is just down further than it should be. Well, this is when you can have some real dramatic results, because quite frankly, any of the other results, which we'll get into, or other solutions that we'll get into, aren't really going to be as effective but it's certainly going to be for this kind of problem. This is where an actual surgeon would need to be consulted with to be able to consider reshaping the upper jaw and perhaps even move your upper jaw. Now, it sounds very dramatic, and yes, it is, but also the results of that are going to be wildly dramatic and going to improve you beyond anything that we can offer to you, whether it be treating the lip or treating even the gums. Now, this is something that we're going to treat the bone and actually move everything up. Along with that, you're probably going to need some orthodontics, so the coordination between the restorative doctor and the orthodontist and the surgeon are going to need to be in sync with each other in order for that to turn out just right. If it's not that severe, and we're just talking about gums, and when you talk about the little teeth, or just simply that there was just, you had normal sized teeth but just had too much gum covering it, well, that's when we can do a much simpler procedure.
That's something that maybe we could help out with.
Absolutely, yeah. And those are really fun because in one fell swoop, you're able to reshape the gum and reshape that scalloping that you see, the rise and fall of the gum tissue, so that it just is up higher. And now what are we doing? We're showing more tooth, and we're taking away some of the gum that's actually being seen. So you get back to uniformity, as well as also relative to the rest of the teeth, everything just looks symmetrical. So that's an awesome way to be able to treat that when you lift the gums up. And sometimes beyond that, the teeth don't necessarily look all that great at that point in time because they were shrouded. That's when we really get a chance to jump in
so
and
what,
really
what
do
do we
some
do,
magic.
man?
We just love veneers. We love being able to do crowns if that's necessary. So again, in essentially 2 short visits, you too can actually have a procedure done that just makes your teeth look great. In addition to that lifting up of the gum procedure, just to be thorough, that's referred to as a gingivectomy. So if you look that up on YouTube, that's what you'll find. That's essentially what a gum lift actually is. Some other things here, I guess, if there's too much gum tissue, again, that can be done with a gingivectomy. That can be done with a knife, or it can be done with a laser. And those are awesome too, because technology is something that we're very much into, and that lasers are cool, and they also leave you in a much better post-operative after the procedure with less discomfort and less pain and no bleeding. So that's also an awesome option for you.
I think more and more periodontists or gum specialists are using the laser to do that.
So
it's awesome technology.
Yeah. So now we talked about if it's a bone problem, actually skeletally, you show too much in the back and the front. We've talked about the gums in terms of lifting them up. What if it's a lip problem? We talked about the lip. You said 2 things: lip is short or lip moved too much.
So
what the heck do we do?
Well, it's lip laser recontouring of the. I imagine they could raise the vestibule and
if your lip is a little short, well, then they can actually do a procedure to pull that lip down so that it covers more. And that's usually a procedure that's done between, I guess, your gums and your nose, inside of your mouth. And they're able to actually literally tie your upper lip down a little further to reposition your lip in a better position, so that, guess what, you now don't see as much gum, and you have a much more normal ratio of lip in the lower third of your face. So the other one, I guess, is if it goes up too high. Like they normally smile. I mean, when they rest, they're fine, and then they smile, and it's like a Venetian blind that goes up, and you see everything, right?
The hyperactive
lip.
So
and
maybe Botox would be.
That's an option. Again, the same
right?
kind of surgical procedure could be considered here. But if you don't want to do something that expensive or that invasive, that's when Botox can be done to essentially freeze the muscles that are surrounding, that cause your lip to move up that high. And make sure you go to someone who is not just doing the weekend course on this one. This is somebody who is a trained surgeon and really has a high level of training in this. And so do your due diligence, ask your questions. Botox is great. It's a great way to be able to stick your toe in the water to see if it's too hot, too cold, and use Botox to be able to kind of temporarily give you results. And what's nice, it might last 3-4 months or so. But then you have to do it again. At least can let you understand if moving your lip or making it such that your lip doesn't actually go up too high is the way to go. But if you don't want temporary results, that's when you need to go to a surgical procedure that would make it far more permanent. And so again, you really need to go to someone who knows what they're talking about, knows how to diagnose, knows the underlying causes of your problem, so that you get the right solution. And that's just about it about Gummy Smiles. So, hey, we know a little bit about dentistry. We're the Ben and Gary Show. And we're looking for your questions, and your social media access to us is through YouTube, as well as through Twitter, as well as also through Facebook. So talk to us. We want to get your questions. Thanks a lot. See you next time.
Bye.